If you've been around mice, rats, or you cleaned that old shed lately, you need to pay attention to these specific signals. Hantavirus isn't a one-size-fits-all disease, it's a shapeshifter. Depending on which strain you catch and which country you live in, it takes two completely different paths. The first stage is the universal phase. It lasts between 1 and 8 weeks. Every single person who gets this virus will feel these early symptoms. It starts with a fever, then the fatigue hits, you feel drained, your muscles start to ache. But here is the first major clue. These aren't just body aches. Hantavirus actually targets your largest muscle groups. We are talking about your thighs, your hips, and your lower back. It's not a dull ache. It is so sharp and so localized that people often think they pulled a muscle or suffered an injury while working. Now, stop thinking about what you feel and start thinking about what you don't feel. Think about the last time you had a bad cold. Your nose was running, you were sneezing, your throat felt like you swallowed sandpaper. Hantavirus almost never does that. If you have a runny nose and a sore throat, it's probably just a regular virus. Hantavirus skips the head cold stuff and goes straight for the core of your body. It's a dry illness in the beginning. No sneezing, no sniffing, just a deep, heavy exhaustion and that insane muscle pain. Around day 4, things get weird. Your stomach might join in too. We are talking about nausea, vomiting, and diarrhea. Some people get hit with abdominal pain so intense they think their appendix is bursting. There are records of doctors actually wheeling patients into surgery for suspected appendicitis, only to find the appendix is totally fine. This virus is the ultimate main character, and it refuses to be ignored, even if it has to fake a surgical emergency to get your attention. By the time the doctors realize it isn't appendicitis, the real symptoms are about to crash down. This is where the road forks. Why does it hit your lungs in New York but your kidneys in Seoul? Scientists divide these into Old World and New World hantaviruses. Old World strains, found in Europe, Asia, and Africa, evolved alongside rodents like the striped field mouse and bank vole. These strains, like the Hantan or pulmonary, target your vascular system and your kidneys. We call this hemorrhagic fever with renal syndrome, or HFRS. Then you have the New World strains. These are in the Americas. They evolved with deer mice and rice rats. Strains like the sin nombre virus are particularly sticky to the cells in the lining of your lungs. They cause hantavirus pulmonary syndrome, or HPS. The geography of the virus is literally a map of rodent evolution. Let's look at the New World path first. You've had the flu for a few days. You feel okay-ish. Maybe you think you're over the worst of it. Then, within a matter of hours, you can't breathe. It's called vascular leakage. The virus makes your blood vessels leaky. Your capillaries actually start letting fluid seep out into the surrounding tissue. In HPS, that tissue is your lungs. Your lungs begin to fill with your own body's fluid. You aren't just coughing. You feel a crushing tightness in your chest. Your blood pressure drops through the floor. This is the crash. It happens so fast it's actually hard for hospitals to keep up. 1 minute you're talking, the next you're in respiratory failure. Now look at the Old World path, HFRS. This is a kidney strike. Instead of your lungs filling with fluid, your kidneys become the target. You get a different set of bizarre symptoms. One of the most famous ones is called facial flushing. You look like you have a bright red sunburn on your face and neck, but you haven't been in the sun. Your eyes might even turn blood red. This is called conjunctival injection. Then comes the kidney strike pain. This isn't a backache. It's sharp, stabbing pain in your mid to lower back, right over your kidneys. Your vision might suddenly become blurry. This happens because the pressure inside your body is shifting so much that the lenses in your eyes actually change shape. You literally become nearsighted overnight because your eyes are swelling from the inside. And then the urine stops. Your kidneys are meant to filter your blood, but the virus causes a protein leak. In a clinical test, doctors find massive amounts of protein in the patient's urine because the kidneys are failing to hold it back. While HFRS is terrifying, the mortality is much lower than the lung version, ranging from less than 1% to 15%. It's a brutal fight, but more people survive it with proper care. Let's recap the 14 big signals. Early on, it's the flu 9. Fever, fatigue, muscle aches in those big groups, headache, dizziness, chills, nausea, diarrhea, and abdominal pain. Later on, it's the 5 red flags: shortness of breath, coughing, blurry vision, facial flushing, and kidney pain. Remember, the most important symptom isn't a feeling, it's a memory. Think back to the last 8 weeks. Did you clean out a garage? Did you sweep up a dusty attic? Did you move a pile of wood? Hantavirus lives in the droppings, urine, and saliva of rodents like deer mice. When you sweep up that dust, you breathe the virus in. It is literally an invisible threat. You don't see it, you don't smell it, but it's there in the dust. This is why the memory gap is so dangerous. By the time you feel sick, you've forgotten about the mouse nest you threw away 2 months ago. Is there an exception? Almost always, it's just mice to humans, but there is one outlier. The Andes virus in South America is the only known strain that has shown the ability to spread from human to human. It is rare, but it happens. For every other strain, the rodent is the only enemy. So what do you do with this information? If you start feeling that dry flu, the one with no runny nose but heavy muscle pain, and you know you've been around rodents, don't wait for the respiratory crash. Don't wait for your vision to go blurry. Go to a doctor and tell them exactly when and where you were exposed to rodent dust. Early treatment is the only thing that changes the math. Mention the word hantavirus specifically. Most doctors don't see this every day, so they might not think of it until it's too late. This virus is fast, it's aggressive, and it's insane how it mimics other illnesses. But now you know the difference. You know to look for the sunburned face. You know to check for the big muscle aches in your thighs. You know that a runny nose is actually a good sign because it means it's probably just a cold. Stay curious about your symptoms, but stay smart about your environment. Here is your one specific action step for today. If you have to clean a space where mice have been, stop. Do not sweep, do not vacuum. Wet the area down with a mixture of bleach and water first. Use 1 part bleach to 9 parts water. This keeps the dust and the virus out of the air and out of your lungs. It's a simple 5-minute step that could literally save your life. Stay safe out there.